For some parents, spanking is the go-to form of discipline, but now new guidelines suggest that doing so can have a negative emotional impact on children.
It's a very big discussion, and here with more, we've got OSF HealthCare Director of Physician Practice, Dr. Brian Curtis. It's a big debate. A lot of folks have different ways of parenting, and they see their ways one way or another, but you know, with these new recommendations, what are we learning?
Yeah, so the American Academy of Pediatrics have not endorsed corporal punishment. I mean, they came out in 1998 saying we shouldn't be doing this. But the new guidelines came out after new studies were showing that spanking a child at 3 more than twice a week actually made the child have more aggressive behaviors at the age of 5 and 8. And actually spanking them or kind of verbally harassing them or intimidating them, the children had actually lower verbal IQ scores. And so they were actually doing poorer just because of that. And they show increased level of stress hormones that actually showed changes in MRIs in the children's brain and their development.
So as a parent, I mean, I'm not at that stage yet, but how do you transform that, maybe how people have done things, into what you're saying are more healthy ways to parent?
Yeah, and so some of it is you practice, you know, and maybe stepping away from the situation if you're charged as a parent, you know, bringing yourself out of the situation, calm yourself before you enter into a conversation with the child. But there's timeouts, catching children being good and actually giving them positive reinforcement, changing your language, so stop saying no or don't to them unless it's a kind of a very critical time. They're reaching for a stove or they're running into a street, so that that word actually has impact to them. But instead of saying stop watching TV or don't do that, change it into a positive thing of saying it's time to read, or instead of saying don't stand, to say it's time to sit. And so you're having a positive implication and you're redirecting them.
This is such a hard topic to talk about. We see a lot of parents who are stressed out. They go too far when disciplining their kids. What can parents do to, you mentioned stepping back, but what else can a parent do to kind of get themselves under control before they decide how to discipline the child?
Yeah, I mean, if the child's in a safe situation, really walking away, you know, just like anything else, walking away, counting to 10, tagging yourself out, you know, saying, you know, and that happens at my house, you know, it's your turn. You know, and so having a parent that hasn't been involved in the charged situation coming in. The big thing is to hear the child out too. You know, the child may have done something, but you have to hear them out. And if it's between two children, don't pick sides. You know, so if they're fighting over a toy, then the toy goes up. You know, or if they're both arguing, you both need to stop. You know, and not saying it, choosing one side or another. But the biggest thing is to walk away and calm yourself down.
What are some of the resources for parents? Like Mark mentioned, that can be very stressful, especially when, you know, you've got a lot of other things, a lot of other factors that are playing a role that parents may be able to go and utilize if they're looking like they're struggling.
Yeah, the biggest resource is really your primary care provider. I mean, that should be a big part of your discussion on your annual checkups. So you're supposed to be bringing your children on an annual basis, and part of the reason we want to see children annually is anticipatory guidance. And that gives us time to explain to you risks for the children, whether it's sex, drugs, social media, all these things that children are being exposed to. But the other piece of it is really how to really discipline a child through the stages of their life, because it actually changes as they age. So using time out on a 17-year-old is probably not going to work. You know, and so it's a different conversation where you're having discussions with them of why they shouldn't do stuff because of negative implications or ramifications. So you're actually having a dialogue with a 17-year-old where you're not going to have the same conversation with a 5-year-old.
And remember, one day that child will be picking out your nursing home.
Hey, things to keep in mind. Absolutely.
It's the little stuff to remind you, right? Yeah.
Whatever it takes. All
Dr.
right.
Brian Curtis, thank you so much for your time. Appreciate it.
We're going to have this interview over on our website, ciproud.com. Just click on the Central Illinois tab. Doc, thanks. We appreciate it. Don't go anywhere. We'll be right back.